This is Michelle Hay. I'm Director of Acupuncture at the Wellness Center at Boston IVF. This is my second webinar that I'm doing. So I will say, for those of you who were listening to me on my first webinar, please give me the next 5 or 10 minutes leeway. I'm going to do a recap of who I am and what I do. So if this part is boring or you already know this information, feel free just to ignore me for the next couple of minutes and then we'll move on from here. Again, my name is Michelle Hay. I'm Director of Acupuncture at the Wellness Center at Boston IVF. Boston IVF at our Waltham location has an acupuncture team. There are 4 people that are on this team. We work 7 days a week. Every single day we participate in acupuncture. We treat patients for follow-up appointments. We treat patients for before and after embryo transfers. We treat patients before and after IUIs as well, and then everything in between. So we treat patients before they start cycling, while they're cycling, after they're cycling. We do often support patients in a postpartum setting as well, once they have attained pregnancy and moved forward from that. We'll see you on the flip side of that. So we treat you beginning, middle, and end. So let me reassure you that soup to nuts, right? We start where you are, where you come to us. If you are cycling, if you are still actively trying to conceive at home, you come in for an initial appointment. We do a differential diagnosis. I'm going to harken back to my original description of a differential diagnosis from the world of Chinese medicine, is where you come in, you have a full intake done with the acupuncturist. We speak about physical, mental, emotional needs. We speak all about, from a gynecological standpoint, also incorporating the testing and the things that you've had done through Boston IVF, and then also look at you from a traditional Chinese medical model. Information regarding sleeping, digestion, body temperature, everything that we need to know goes into an algorithm in my brain. A differential diagnosis is attained that way. We treat you from an acupuncture standpoint on the front part of your body, on the posterior aspect of your body. All of these needles, single use, fully disposable, nothing scary, right? And so the goal is to treat you. I'm going to come back to the statement of where you are, which means if you are actively trying to conceive at home, we speak to you about your natural menstrual cycles. If you are participating in an IVF cycle, we treat you. Are you on stims? Are you starting stims? Are you waiting for cycle day 1? So we treat you based on where you are cycle-wise. We're looking to invigorate blood flow into the uterus and endometrial lining. We're looking to mitigate spasms and cramps if you're in the period of time where you're using stims. If you're in the period of time that you're actually having a transfer, we're looking to optimize you on that transfer day. Beforehand, if you are taking stimulating medications, we also are able to treat a variety of different side effects of the medications, of headaches or constipation and things along those lines, while still focusing on optimizing that IVF cycle. So, excuse me, I'm going to pause here. I often get asked the question of when should I come back and do acupuncture, right? So it's where you are. And that statement is totally depending on, are you in this process of IVF? Are you in the process of IUIs? Have you even started? Are you actively trying to conceive at home? The job of an acupuncturist is to do investigative reporting, to tease out what we want to know, but then also to circle back to all the information from the Boston IVF side of, right, are you using Gonal F? Are you using Cetrotide? Are you, I'm throwing out a variety of things here. Do you need help with your endometrial lining and the thickening of your endometrial lining? Are we looking to optimize little bits of medication side effects or a variety of different positions that you could be in? Sorry, I stuttered and hubbered there for a few minutes. Because we treat a variety of patients, and we're not always going to get you right. You need to come on exactly this date, and we would like to see you on this Wednesday, and that's just not real life, right? Time and money are also very real things. I understand that during particular instances, we will treat patients more acutely. Well, maybe we'll see you twice in a 10-day time period, or or a little bit closer together, especially if you're using stim medication and you're during that time period intensity of stims. But there's plenty of times where we see you where you're waiting on cycle day 1 and your IVF cycle got pushed back, or your transfer cycle got pushed back. And so we'll treat you typically once a week. Typically, we treat you once a week, 4-6 weeks in a row. Then there's an assessment period. How do I feel that you're doing? How do you feel that you're doing? What's happening with your cycles? Are you doing a transfer? Are you not? And then sometimes we space treatments out, because this is not a sprint most of the time. This is definitely a marathon. And the world of Chinese medicine is looking to optimize you as an individual, and then you where you are in your cycle. So we treat you very much based on where you are at that time, and looking to get your pituitary, your thyroid, your ovaries to speak better together. We see such a variety of patients. We see patients that are just on their first IVF cycle, aren't even on an IVF cycle, that are actively trying to conceive at home, to people who have done a half a dozen IVF cycles, or maybe they're coming back for baby number 2 from a secondary standpoint. And it is our job as an acupuncturist to tease out the information that we need to know, to optimize where you are in your cycle, to get the best out of your cycle, to help you get to where you want to be, right? If the goal is, right, we're really looking to manage these side effects while also get you to tolerate this better. Okay, that's part of the treatment strategy, while always looking to optimize that IVF cycle, that IUI cycle, or that actively trying to conceive, potentially timed intercourse at home cycle, so that we follow you where you are. Right, so I know I've done my quick recap there. There's some great questions that have been thrown out to me that I'll try to circle back to intermittently. I have to admit, sometimes I do get stymied. So bear with me when I'm reading and speaking at the same time. One of my questions was, does acupuncture help with IVF? And the answer is, that's too broad of a question. If we are looking at specifics of, does it help from a psycho-emotional standpoint? Absolutely. Does it help from a physical standpoint? Absolutely. Does it help from a side effect standpoint? Definitely. Again, we're speaking about time and money here, so resources can be difficult at the best of times, right? Resources including time and money, right? Both of those things I think of together. Because sometimes you have so many appointments, you think, oh my gosh, I can't handle another appointment. That is something that I openly will speak to patients about, this should be something that benefits your life, not something that you think, oh my gosh, I've got this other appointment that's driving me nuts. So the broad answer is yes. The very specific questions, I would encourage you to contact Robin, the patient care coordinator, Robin Lasky, and have her send an email to us, phone us. There's an acupuncturist there every single day at our Waltham location. We would happily speak about you as an individual. Today is broad strokes, right? So I can speak in general. One of the other questions about the resources available as a patient at Boston IVF, we have clinical nutrition, we have counseling that is there, we have obviously acupuncture, right? I'm an acupuncturist here, that are there 7 days a week. Robin Lasky, again, I will come back to her, is the patient care coordinator at the front desk at the Wellness Centre. She's the one who books all of our appointments. She's absolutely fabulous in that manner. She keeps all of our schedules straight. There's 4 different practitioners. There's 2 different clinical social workers. There is a registered dietitian, Hilary Wright, who has written 3 books on PCOS. She is our PCOS guru. She's absolutely fabulous. Now, with that being said, she is a wonderful resource for anyone that is looking for nutrition help going through an IVF cycle. There are so... Hold on, I'm going to try to be diplomatic here. So many misleading things out in the interweb, the internet. Sorry, that's my husband's joke, the interweb, where you should be doing this and you should be drinking this tea at 3 o'clock in the afternoon, and then you should lift your right leg and then you should lay on your left side. And oh my, some of the things are so specific and so exclusionary. You have to cut out sugar, you have to cut out wheat, you have to cut out dairy, you have to cut out this, and you have everything. For some people, if you have celiac disorder, yep, gluten is not your friend. If you have a dairy allergy, yep, dairy is not your friend. There's extremes. Again, I'm going to come back to the spectrum of life. There are some people that have gluten intolerance where you eat a bunch of gluten and it doesn't make you feel good. And so as individuals, you need to find out the best nutrition plan for yourself. There are some general rules that we tend to follow. I'm a huge advocate of, eliminating as many pesticides as possible. I'm going to use the word organic. But I'm an advocate of more organic-based foods. I am not a vegetarian. I do advocate protein in a variety of sources. If you are a vegetarian, there's a variety of sources that you can participate in. Hillary Wright can help you with that. There's all different types of stuff out on the internet that I also said was really evil earlier. The dirty dozen or the dirty 15, things that you could focus on optimizing on those foods. From the world of Chinese medicine, optimizing foods during specific time periods of the year are helpful. It's an embarrassment of riches to come into the fruit season and the vegetable season between spring and summer in New England. Capitalize on that. Less processed, more individual foods. I know there's lots of things out in the world about protein shakes and a variety of things. There's very questionable clinical evidence about how much you actually absorb for protein shakes. So I will always advocate food, whole foods, entire vegetables, entire fruits. I'm a big advocate for that, which sounds a touch old-fashioned. I will get off my high horse there and say Hillary Wright is absolutely fabulous. And I've already mentioned the clinical social workers, Stephanie and Dylan. And I think I remember Zoe saying that earlier today, Stephanie did a webinar regarding picking different coping skills and utilizing different coping skills throughout this challenging period of time that you can be in. And then also looking at that from the Infertility Awareness Week. What does that mean from a psycho-emotional standpoint? I'm going to come back to that from the perspective of Chinese medicine, but let me just answer a couple more things. Oh, hi, Ariane. It's nice to see you. So general benefits of acupuncture overall. I think I have spoken about vasodilation, which means moving blood, managing side effects, mitigating side effects of different medications that you're on. And then if we're lucky enough to get you before you start medication, to optimize you as an individual. Plenty of patients come with endometriosis, with PCOS, with anovulatory issues, with a variety of thyroid-based issues, and period issues in general. You might not have endometriosis, but you may have really crummy periods. Well, the world of Chinese medicine, that's a fairly common thing to treat. Or you would like to say, if there's some ovulatory dysfunction there where your cycles are irregular, but you're not necessarily part of the PCOS spectrum, that's something that is commonly worked with in the world of Chinese medicine to get that pituitary, the thyroid, the ovaries to work together. Now, with that being said, humans are complicated. There are plenty of people who have significant issues and complicated medical issues as well. And acupuncture slots right into that treatment strategy with your reproductive and endocrinologist almost seamlessly, because there's no contraindications. We're not providing you with an extra medication or an extra something. We have to think about side effects or negative consequences. It doesn't work that way. They work quite well symbiotically together. And again, we treat you where you are. So our treatment location for acupuncture is only in Waltham presently when we are in-house. I know we have a number of satellite clinics. There's New Hampshire, there's Long Island, Long Island, I think I might be saying that was the wrong thing. New York. We don't have on-site acupuncturists there. If you are at one of those satellite offices, please contact that office directly and find out if they have a practitioner that they can refer you to. I know in New York, there used to be a practitioner that would work in-house, but I believe that practitioner left either during or before COVID, and so it's been a bit sticky. One of the questions at the top is about Chinese herbs, that we do not participate in that at our Waltham location. I know a number of you will have independent practitioners that you work with. those practitioners that you work with, you need to let your reproductive endocrinologist know if you're working with a practitioner that way. Everything needs to be across the board. The medications that you take, especially for an IVF cycle, these are significant medications that have significant side effects. And we're not 100% sure of the contraindications there or drug interactions. So that typically is something that is done before you participate in any type of stimulating medications or anything along those lines. And speak to your reproductive endocrinologist about it and have a good timing. And perhaps your reproductive endocrinologist could speak to your acupuncturist or your herbal practitioner. But you definitely need to have them communicate so that everybody knows what you're taking. There is a question in regards of egg freezing cycles. So for an egg freezing cycle, we treat you the same way that we would treat anyone else that is participating in an IVF cycle. We're looking to support you all the way through that process at the beginning. We probably see you before cycle day 1 because we're looking to fluff and buff you before you even get there. Because the retrieval process, most of the time, now I'm not a reproductive endocrinologist, so I'm not trying to pretend to be. I've worked at Boston IVF since 2006, so I have seen the trajectory and I feel comfortable speaking about this. Anything specific beyond this, please speak to your reproductive endocrinologist about this. Most of the time now, the treatments that patients are participating in are freezing of eggs that subsequently become embryos, and then having a thaw cycle afterwards. There are plenty of people that still participate in day 3, day 5 transfers. Fresh cycles are still happening, but more often than not, we are treating patients who are participating in looking to do a retrieval and then freezing their embryos. So from the world of egg freezing, it's the same thing. We treat you ahead of time. We look to optimize the medication that you're on. We're looking to vasodilate, meaning move blood, to optimize those ovaries so that you can move forward with the best retrieval cycle for your body and your expectations, and then managing the side effects of some of those medications as well. Speaking about timing for acupuncture around IVF cycles, there are a couple of options out there. We treat patients, the first and easiest is we treat patients on the day of transfer. Because we have an acupuncturist every single day, 7 days a week at our Waltham location, where the majority of the transfers are done for us, obviously. We are able to treat you right before and right after an embryo transfer. It's referred to as our pre and post acupuncture. It's every single day we do this. So everyone, you get an email ahead of time if you are having a transfer. They send you that transfer time. You phone Robin or the patient care coordinator at the desk, because sometimes it's different on the weekends, and you schedule your acupuncture appointment typically an hour before, an hour after. Now, that's a snapshot of what we're looking to influence just on that day. Sometimes it doesn't happen. Sometimes we have patients that have to travel. Sometimes we have patients from different IVF centers who come to us because we have the acupuncture team that, should I say, are fabulous? Yes, I will say we're fabulous. But, excuse me. It's because we're in Waltham and we're 7 days a week and we're part of the surgical center. So we will often have patients from other clinics come to us. And frankly, we've been there since 2006. So we have had acupuncture at the Waltham Centre since 2006. We have that much experience. And to use a silly phrase, right, we do this every day and twice on Sunday. This is our forte. This is what we're really good at. So this is why patients come from other clinics. Sorry, I'm going to get off my high horse and stop patting myself on the back, and I'm going to go backwards. We see patients on that snapshot on that day, just before, just after. Sometimes we don't even get to see you beforehand because you travel from Maine or you're traveling from somewhere else and you have to drive for 2 hours, and you come in and you have your transfer and we see you afterwards. So we'll see you for that appointment afterwards. If we're lucky enough and you live around the surrounding area, we'll treat you ahead of time. Maybe we'll treat you a couple of weeks. Maybe it's 4 weeks. Maybe it's 6 weeks. If I could, time and money, real things, maybe I get to treat you for a couple of months before you even have your retrieval, or months before you have that embryo transfer. The spectrum of patients who we see is rather wide. And for most occasions, I'm coming back to my original statement because apparently I'm repeating myself today. It's a trend. This is a marathon. This is not a sprint. And so we treat you all the way through this process. So waiting wise, scheduling wise, ring Robin, the patient care coordinator. She will look at your schedule. We have excellent availability. Most of the time we book a week out, 2 weeks out for initial appointments because we're there 7 days a week. Now, if you can only come at 4 o'clock on a Tuesday or something, and that's the only time you can ever come, that might be a little bit tricky. But if you have some flexibility, maybe you could come on a Sunday afternoon, maybe you can come first thing Saturday morning. We do rotate through on the weekends. So that is something to be aware of because there's 4 of us. And so we do rotate through because we each take 2 days a week for the most part. And then we rotate through in the weekends because we're open 7 days a week. So we have excellent availability. As for the before and pre and post acupuncture, you find out with the email, and that's when you phone us. We always have availability, aside from somebody getting sick, frankly, and an acupuncturist not being there, or one of our snowstorms. Sometimes we do have issues during snowstorms. I'm throwing out all the options here. It's April. I'm not sure why I'm still on the snow front, but never mind. We always have an acupuncturist on. So when you find your time, you get your email, and you want to include acupuncture into your transfer day, you ring us. You can even tell your nurse ahead of time. And then when your time slot gets booked, it'll actually say once pre and post acupuncture. So we kind of have a heads up and we make it work. We really do. And say it has to be the day after or the day before, or there's some type of schedule, or your work is crazy pants and you can't stay longer. We make it happen. We are very supportive of that. So I've answered one of the questions about that. Oh, excuse me, I forgot to say, your initial appointment is typically 90 minutes. A follow-up appointment is 1 hour. Now, I am notorious for this, and if any of my patients are listening, I'm really sorry, because I tend to keep my patients for about 70 minutes, sometimes 75. I have specific things that I want to do, especially if a patient is cycling. But on the anterior front of the body, acupuncture needles go on the posterior aspect of the body. Sometimes it's just one side. Sometimes it's both sides. Sometimes a patient will have a specific thing that is also happening that I need to do a little bit of moxa here, another adjunct. Or frankly, sometimes you just have to talk about what's going on. I'm going to circle back to the Infertility Awareness Week for just a minute. Hang on. And I'm going to look at this. I'm going to bring this back from an emotional standpoint. The main reason why we're speaking about National Infertility Awareness Week is because people need to talk about this more. There is a statistic, hold on, I've got my piece of paper here, from the CDC that speaks about 1 in 6 people are affected with infertility or needing fertility help. That's a ton of people that are out there. Now, obviously, there's particular parameters, age-wise, blah, blah, blah. I think this is only based on, heterosexual couple. It's only a statistic. Bear with me here. But that's a ton of people. And this should be something that there needs to be better understanding, greater awareness. From the world of Chinese medicine, when you experience fear and anger, it tends to pull you in. It tends to draw everything in. And the character that's used to describe that over a long-term period of time is stagnation, which is stuckness, right? You can feel it. It's like a ball that either sits in your chest or sits in your abdomen. And it tends to spin on itself, right? All those thoughts, all that stuff, that ruminating. And you tend to pull in and you pull your shoulders in, and physically you feel this way. And then emotionally you feel this way as well. You pull back from people. You stop participating in things, mostly as a protective mechanism, because sometimes you just can't. And there's so much energy. Again, I'm going to come back to the Chinese medical perspective. There's so much energetic output, all these appointments, all this blood work, all these ultrasounds. And by the way, these are not just jelly on the belly type of ultrasounds. These are full-on vaginal ultrasounds, which some days you're like, yeah, no big deal. And then other days you think, oh my gosh, I have really got to steel myself for this. And perhaps I'm not up for this today. And nobody cares because it's cycle day 3 and I have to get this done. And so I'm throwing these things out there and I'm speaking really frankly because that stagnation and that stuckness pulls everything in. And from the world of Chinese medicine, bringing everything back out is what we want to encourage. Invigorating blood flow to the uterus and endometrial lining, mitigating spasms and cramps, increasing circulation to all four of the extremities. If you could see me, I have my hands out and my legs out as well, because that stagnation doesn't help anyone. And part of that is also from an emotional standpoint. Some days you can speak to people when they say to you, how are you doing? And you think, yeah, okay, I'm okay. I'm hanging in here. You know, I'm doing this thing. We're doing this fertility thing and I'm feeling okay. And then other days you think, I'm not going to talk about this. Or if I talk about this, somebody's going to say something really stupid. Or I don't have the energy to talk about this today because it hurts just now. And all of those things are acceptable. They all are. But as a group and as a community, or even as an acupuncturist, being part of this is also listening. I'm going to come back to why sometimes my appointments are 75 minutes long. So thanks for all those patients that hang in there with me. I'm not looking to suck up all your day because that's part of it. The world of Chinese medicine, I need to look at you physically, mentally, and emotionally because all of that matters. All of it matters. You are not just a uterus. You are not just ovaries. You are not just a pituitary thyroid. Wait, what did I say? I skipped a gland there. These things matter. And part of being in this fertility world is hanging in there long enough to let the reproductive endocrinologists do what they need to do, to let the acupuncture team to be there to help, to let the registered dietitian to be there, to let the social workers help you from an emotional standpoint, to get you to hang in there long enough. Because that's the number one reason why people leave fertility treatment is because the stress can be overwhelming. And from that Chinese medical standpoint, it brings everything in. And that fear from the world of Chinese medicine chips away at your reserves. It truly does. So the world of acupuncture is looking to move some of that stagnation, to decrease that ruminating, that ball that sits on itself, that spinning in your head, to help manage some of that fear and that sadness, because there needs to be that hope there, right? Because that's why you do this, so that you have this team of people that can help you. Because some of this you will hear from the world of fertility, where you go and you look online and a variety of things, where sometimes it happens faster for others and slower for some. Right? So where are you on that spectrum? What does that feel like during that time period in that moment? And how are you coping with that? And that's where you build that team around you to help you get through that and to hang in there. Right. So off my soapbox, a couple of questions of how long does it typically take to see results with fertility treatments? Fertility acupuncture, excuse me. I'm going to give another very vague answer and say it completely depends. Depends on what your goal is. Depends on where you are on that spectrum of what's going on with you physically. Are you actively trying to conceive at home? Are you participating in a retrieval cycle? Are you doing a transfer? Is your definition of seeing results live, take home baby? Everyone has their own threshold. For some people, it's, I just want to get to retrieval. I just want to see my follicles grow and optimize my follicles. I really want to see my endometrial lining grow. I'm looking to mitigate some of this terrible constipation or these awful migraines that I have during stim medication because I need to function and I still need to take these stims. So it's a very broad spectrum that I'm speaking about. But again, people are complicated. They really are. But this is why you need to have a good practitioner who does that differential diagnosis, who asks you a ton of questions and then circles back to you. Typically in 4-week, 6-week increments, if I'm lucky enough to have a patient that I see consistently. How do I feel that you're doing? How do you feel that you're doing? We have very open lines of communication. What's better? What's worse? What are we seeing results with? What are we not seeing results with? If you are cycling, there's very tangible feedback. you get blood work, you get ultrasounds. There's a variety of things that we can speak about. Sometimes when you're not cycling and you're in the in-between times, I get to see patients unencumbered. They're not managing some of those side effects. It is you at your baseline. This is when I start to get the real answers of what's going on. How's your sleep? How's your energy? How are you feeling? Are you feeling irritable? Are you at home and just the brain is going? Are you terribly sad? Are you having trouble thinking, how am I going to do this? These are the things that come out when patients aren't actively cycling. And these are things that you are able to use as benchmarks of what's better, what's worse, what's the same. I know when I'm speaking about sleeping, energy, psycho-emotional well-being, or digestion is another big one as well. I'll have patients will say to me, that doesn't have anything to do with my ovaries. It's like, yes, I know, but it does have to do with you as an overall. Part of physical, mental, emotional assessment and well-being is if you're laying in your bed and you're staring at your ceiling until 1 o'clock in the morning, and then you have to get up at 5 or 6 to start your day, and this is a constant cycle for you, well, that needs to be addressed. From a hormonal standpoint, sleep is heavily influenced, your hormonal well-being at a baseline, even outside of the fertility world, is heavily influenced by your sleep. So that's something that needs to be addressed, because then emotionally you won't feel like yourself. And there's that energetic potential of, if you have to give all the time, there needs to be a period of time that's restorative. So through good sleeping, through good management of support system, lovely people around you who are supportive, who can speak to you, people who actually give back to you, right? Who make you feel good about yourself, who you can have open conversations with. Maybe you speak to them about this fertility stuff. Maybe you don't. Maybe they're just a lovely support to you. I can't I cannot stress these things enough in a positive manner. These things matter. To come back to that Chinese medical mentality, that stagnation where everything pulls in. From a circulatory standpoint, that doesn't benefit anybody, physically, mentally, or emotionally. Being able to move, have some form of exercise. Exercise means a variety of things to people. What I like to ask is, how do you like to move your body? What do you like to do? For some people, they rock out at Zumba classes every Tuesday night at the Y. For other people, they're running, they're cycling, they're swimming, they're doing a variety of things. Others, it's, I walked my dog 3 times today and it feels wonderful. All of those things help from a circulatory standpoint, from a moving standpoint, all in an emotional standpoint as well. You're still getting out of your house, you're still moving that stagnation, especially in the springtime. Springtime is notorious for stagnation from the world of Chinese medicine. You're transitioning from wintertime into spring. Some people could do it really well. You rock out, you're ready. Other people think, nope, I'm not happy. I'm feeling stagnant. I'm having difficulty getting out of my own way. I feel irritable. I feel restless. Such classic liver qi stagnation from the world of Chinese medicine. And that's part of my differential diagnosis. And if you have an acupuncturist by you, those are the questions they should be asking you as well. Sorry, I went on a tangent. Let me come back to some of these questions. There's an individual who's asking about, she lives in a more rural area, specialized in fertility. So a general practitioner, acupuncturist-wise, should be quite fine to see, as long as they are savvy to the world of gynecological well-being. If they are people that are comfortable treating you through a menstrual cycle, asking you questions in regards of your menstrual cycle, and then treating patients during pregnancy, they should be comfortable treating you and knowledgeable. If they have specific questions, you can refer them to us. If you want them to come and speak to us, I'm happy with that. It should definitely be somebody who understands about fertility treatments, though. They shouldn't be, I do understand the word specialty is a little tricky. If you're not living in this area where it's saturated with all different types of medical practitioners. A general practitioner where you live can be someone that will do an excellent job, but they have to be savvy. You know, if you're seeing a practitioner and they only ask you 2 questions about your period and they have no idea that you're about the difference between a fresh transfer or a thaw transfer, or they don't quite understand about doing retrievals or what that looks like, or I'd hesitate a little bit there. They should be asking you about gynecological well-being and have enough knowledge to treat you that way. Some of the specifics, okay, they can swat up on, or they can phone us medications and things along those lines. I hope that answers your question, that the individual who was sending that from Maine, a bit vague. So there's a practitioner who's asking about, is pre and post embryo transfer beneficial enough versus weekly appointments? Depends, right? Time, money. If it's super stressful, if you can't get to an acupuncturist near you, if it won't work for you time-wise, financially, then pre and post is what you need to do. And that's what we'll capitalize on, and we'll catch you on that day. If we're lucky enough to catch you ahead of time, listen, I'm an acupuncturist. I've drank the Kool-Aid, right? I always want to see patients beforehand, as far as I can get you, because then I actually get to know you at your baseline before you start utilizing medication. And then I get to shift things before you even get to that retrieval stage or to that transfer stage, because the world of Chinese medicine is very much about preparing, right? But very proactive versus being reactive. There's a question in regards of negative risks associated with acupuncture before embryo transfer. Nope. No. If you're seeing a licensed skilled practitioner, especially in the state of Massachusetts, you have to be a licensed practitioner here, a qualified practitioner. There's no contraindications. These are single-use, fully disposable needles. No, I'm going to say it just like that. And I won't even go any further. Question regarding tangible evidence in increasing success rate with embryo transfers. The last study, there's been a couple of meta-analysis that have gone on. The last study that was doing this was 2002, 2004. The studies looking at, so it was a very good study that was done. I think it was 2004. So a long time ago at this point. It was an excellent study that was done. And it was a very large patient pool with a diverse group of patients that showed that there was an increased rate of take-home baby utilizing acupuncture before and after. There have been a number of small studies that have been attempted after that, but they tend to be smaller. There are lots of studies done in China and Japan looking at that. But in America, there has not been a large volume study for that. So I cannot give you up-to-date percentage-wise for that. Sorry, not helpful. There are customized, there's a question in regarding customizing acupuncture treatment for different fertility diagnoses like PCOS or endometriosis. It is the job of your acupuncturist to do a differential diagnosis. I can have 4 different people sitting in my treatment rooms that have a diagnosis of endometriosis or PCOS. And from a Chinese medical standpoint, they will have individualized diagnosis from the world of Chinese medicine. So working, especially at Boston IVF, you need to have 2 different, oh, that's funny, sorry. You need to have 2 different parts of your brain, the Western medical side and the Chinese medical side, and then they meet somewhere in the middle. Every time you come to an acupuncturist, you are treated as an individual, not just as your diagnosis. So we treat you based on the knowledge that we have of PCOS and the trends of people that have PCOS and what we would look for, but and ask appropriate questions that way, but then look at you as an individual. How is this affecting you? Because life is a spectrum, including patients who have PCOS are a spectrum. Patients who have endometriosis are a spectrum. Male factor infertility is a spectrum. So we do look at those things, but also integrate it into you as an individual. Health insurance wise, I can't give you a good answer for that because there's so many different health insurance plans out there. We do accept flexible spending. Robin, our patient care coordinator, does codified receipts. I have a number of patients who provide their health insurance with the codified receipts, and then they get money reimbursed directly back to them. Please contact the front desk, Robin Lasky, the patient care coordinator at the Wellness Centre. She's far more knowledgeable than I am in regards of any of those insurance options or what happens or codified receipts and things like that. I'm going to come back to that spectrum of patients who we treat. Actively trying to conceive at home, participating in fertility treatments, IUIs, IVF, thaw cycles. We do support to patients who participate in donor egg transfers as well. We participate in treating patients postpartum. We also treat patients post-miscarriage, post-loss. I think that that's something from the world of infertility awareness that we should speak about more often. I'm not a clinical social worker. Stephanie and Dylan are absolutely fabulous and they give great support to patients. We treat patients afterwards loss because this roller coaster of fertility treatments, the up, the down, loss is something that is experienced by a variety of patients at a variety of times, and we treat you after that. We tend to treat patients during that time period of waiting as you heal physically, mentally, and emotionally. We also work in conjunction with the social workers. I'm going to come back to them and encourage patients to participate in that. I know that they have grief counselors as well that they refer patients to. So I don't mean to leave that out of the discussion. That was a question that was placed into the chat group. So I did want to mention that as well. So good luck in your journey, my friend. Please seek out the support that you need, and come to us. So I've spoken about insurance. Age bracket wise, we don't have an exclusion for age. I know Boston IVF does. They have a variety of parameters, so we tend to follow those parameters. I have a wide variety of patients that we support, especially if participating in treatments is not feasible. I will treat patients that'll come for a handful of months, up to a year, that'll actively try to conceive at home, and we try to optimize things. There's a whole gamut of patients that we have seen over these last almost 20 years that we've been working at Boston IVF. Coming to something that a patient has asked just now, not a silly question in regards of clothing and attire to wear to an acupuncture appointment. Loose fitting clothing is lovely. However, I have plenty of patients that'll come to me that'll think, oh my gosh, I've forgotten and I'm wearing skin tight leggings. What do I do? I've got towels. You won't have to lay in the table in an uncomfortable manner. We will towel you. Most of the time it's best if you go in comfortable clothing. Typically I like clothing where I can pull up your trousers above your knees, because there are points around your knees that I gain access to. A lot of times patients are comfortable. If there's something that I need to get at your chest or at your shoulder or something at your back, I'll have patients take their tops off, keep you covered, of course, so that nobody feels exposed. And we treat you accordingly. Warm table, lovely heat lamp at your feet. We definitely keep you cozy. So thank you for that question. No, not silly at all. We get you on the table and get you comfortable, because the goal is to have you be on the table to feel as comfortable as you can, so you can sustain your position from anywhere from 15 to say 35 minutes, depending. Do I flip you? Am I doing these things? 30 minutes is average that you would maintain on the table, where I pop the needles in and you percolate, is the expression I like to use. I know, so there's a couple of specific questions that have been in on this chat about different medications that you could take or over-the-counter things. And I'm truly going to ask you to go back to your reproductive endocrinologist about that, especially questions regarding aspirin. There's always a mention about pineapple and pineapple core. I don't encourage people to eat pineapple core. I think pineapple is lovely, and I think you should eat pineapple, but the pineapple core is so difficult to digest. It's so fibrous and really tough. And I don't think that there is significant difference between the pineapple core and the pineapple fruit. So eat the pineapple fruit. I would not encourage you to eat the core. I think it's way too difficult to digest. The Hillary Wright, the registered dietitian, she would be clapping at me for that, saying, don't have them eat it. It's so hard to digest. Excuse me, would I treat a woman going through egg donor conception the same as you would a woman doing IVF with her own eggs? No, it's a different treatment because we focus a little bit differently because you need different. We don't have to think about the retrieval process. We don't have to think about it from that perspective. However, there are a number of similarities based on an embryo thaw, having an embryo thaw cycle. So if you've participated with your own eggs and you've done a thaw cycle in the past and you're moving on to donor egg, you'll be familiar with how we would treat you and the questions that we would ask. I still do a differential diagnosis and treat you as an individual. It just shifts a little bit. We look at it from because we're not looking at those stim meds or things along those lines, and I don't have to think about that perspective. But so it's a different treatment in so much as you are in a different place, but we treat you where you are. There's a question regarding acupuncture and miscarriage, and I will have to give a vague answer of that's really complicated in means of prevention. We very commonly treat women during the first trimester, and that's a common thing that we treat at Boston IVF, where we treat patients through their first trimester weekly, and that's a reflection of just how safe acupuncture is during pregnancy, including the first 12 weeks of pregnancy. But to speak about miscarriage and acupuncture is complicated because there's a variety of reasons. There's a spectrum that people present with, and people are complicated. So I have to be somewhat vague there because I can't give quite a definitive answer for that. So a couple of specific questions. We have worked with patients who have premature ovarian insufficiency and a premature ovarian failure. That I agree with you that is a diagnosis that perhaps practitioners aren't as aware of as they need to be. From the world of Chinese medicine, that differential diagnosis is important because you're looking at what is happening beforehand as well, like your periods in general and how your menstrual cycles have been. So those questions about your baseline are important, and that's something that a practitioner should be asking you about. I already answered a question about acupuncture during pregnancy. Sorry, excuse me for a pause. Acupuncture costs. Our treatments are $100 per appointment. Our initial appointments are more. Our pre and post embryo transfer on that day. The 2 appointments. I'm going to pause there. I think it's $180 because we treat you before, we treat you after. You have to be there, and there are a number of practitioners around the Boston area that if you need a practitioner who's closer to you, a practitioner that accepts insurance or doesn't accept your insurance or a variety of other things. Sorry, I'm pausing. There is an acupuncture school in Worcester called MCPHS, and they have a variety of healthcare practitioners out in the western part of Massachusetts. You can contact them and ask for referrals. There are numerous practitioners around the Boston area. So ask around in your community and then phone that practitioner if they're close to you, because you need it to be something that works, right? I want everyone to come to us. I really do. We have the most experience. We have fantastic practitioners. We're open 7 days a week. But I understand that that's just not feasible. If you have to travel an hour to come to us, As much as I think it's worth it, if you're coming for an hour and you have an hour acupuncture appointment and then you have to drive all the way home for another hour, that's so stressful. And I feel confident, especially in the Massachusetts area, that you should be able to find a practitioner who's closer to you. Because if you have somebody that's 10 or 15 minutes away from your house, it's just going to work better and it's going to feel better because it's something that's going to bring benefit to you, and it's not going to be stressful. So please consider that an option. Go on the internet, look around you. If you ever want to phone Robin and say, do you guys know anybody? You know, Ellen Leifman, one of the practitioners that I work with, she used to teach at MCPHS, so she knows a variety of people in the area. She's a great resource for us. There have been times where I have phoned practitioners just to kind of suss stuff out. I'm always on the up and up. I never try to deceive anybody, but I will think, okay, is this a good fit? You need a practitioner that's going to listen to you, probably similar to the way that you pick your physician, though, right? Is this somebody who listens to you, who really gets you? For some people, as a patient, you need analytics, you need that data. For other people, you need somebody to listen to you. You need somebody that gets you, that speaks about that emotional component and not just the analytical. For some people, you need something in between, or you need somebody that's willing to look a little bit out of the box. The world is full of all different types of people, including practitioners. So find someone that's a good fit for you. Excuse me, I think I misspoke. For that, there is in regards of pricing, our follow-up appointments are $100. The $180 is just on the day of embryo transfer. It's that before, it's both appointments. Sorry. We do support male fertility. That's something that we would encourage men to come for. I have to be perfectly honest with you, though. 95% of our patients are female. Men don't come. They just don't. I can't tell you how many supportive partners, spouses, husband, you know, the whole gamut. And I've spoken to them on the phone and we've talked about a variety of things. We even have a male practitioner who comes in 2 Saturdays a month to work with us. And men don't come. And hold on. I don't stick needles in men's penises. I'm upfront about that. And I know that's ridiculous to have to say on a live stream. I tell men that all the time and they don't come. We would love to treat them. We would love to see them. I imagine there are far more male factor fertility patients out there than they would be willing to admit to us that we could woo them to come to us. I think there's a lot of social stigma for men. And I think there is this, I don't need to, sorry, I'm being very judgy here. I have a male partner myself. And sometimes I think, why don't you just take care of yourself? Smack, you know? No, I don't. Sorry. No, I don't smack my partner. But it's mentally, I think, come on. There's nothing wrong with taking care of yourself. And from a societal standpoint, I like to think that that's changing, but it's changing slowly. All right. Sorry. I was on a bit of a high horse there. There's an individual who's saying that they have to travel for a large, where's the best? Oh, yeah. Well, if you have to travel to come and see us, more than likely you're traveling to come and see us for your transfer. If you're coming to us on the day of your transfer, book an appointment with Boston IVF. Book an appointment at the Wellness Center. Just for that pre and post, come and see us on that day. I say to patients all the time, I will happily be your backup acupuncturist because it's stressful. It's so stressful for the day of your transfer. And we get you in the right place, in the right time. We fluff and buff you, so to speak. And emotionally, we set you so that you feel more calm and more grounded and you're ready to roll on that day. But if you're having to travel for regular acupuncture appointments, as in regular follow-up appointments, 6 weeks ahead of when you have your retrieval, no way. Go find somebody closer to you because that's way too stressful. As much as I would like to see you, and I would focus on the day of transfer. That would be my focus because it's too much pressure. There's already so many things that you're having to do and participate in. That's just too much pressure. So I've got about 5 minutes left here. excuse me, I dropped my piece of paper with my couple of notes. I'm going to review here and see if there's anything that I didn't mention that I wanted to mention. Throw out any other questions if you have any questions down in the 11th hour here. Again, I'm Michelle Hay. I'm Director of Acupuncture at the Wellness Centre at Boston IVF. We're open 7 days a week. There's a practitioner there every single day. We do this every day and twice on Sunday. Did I mention that before? And we would love to be part of your team of people to take care of you. There is a toolbox that we all have to carry with us through life, right? And some days you can rock through and you think, yep, I'm doing this. I got my coping skills. There's a couple of things here. I got this. I can fly through this. And then other days, it doesn't work, right? You're overwhelmed, a wee bit beaten down from the things that you've had to endure. And to come back to that Chinese mentality, it's that energetic potential that you're putting out, right? It takes so much energy to do this. Having that group of people around you, you know, your reproductive endocrinology team, they do a great job. The nursing staff, a wonderful job. The role of acupuncturists, of the social workers, the registered dietitian, we can be part of this whole spectrum of people to get you through this part, to help treat you physically, mentally, and emotionally. Because I don't know if you remember, you know, me speaking about the stuff in the beginning, how all that emotional stuff can become so stagnating to you. Being able to identify that and to see when you're in that hard place, right? The ebb and the flow. Sometimes you're in that trench and you think, what am I doing? What am I doing? How am I doing this? What am I supposed to do here? You pull from those teams of people that you have. You rock the coping skills that you have, and you pull out new ones. And you build that team of people around you, friends, families, you know, professional staff as well, so that on those days that are really hard, you have other places to turn to, and you have different coping skills or different things to be able to get you out of this. Because remember, this is a marathon. This is not a sprint, and this can be a far more protracted experience than some people anticipate. So I'm going to leave you, Zoe, my fabulous IT individual and webinar extraordinaire coordinator, will provide Robin Lasky's phone number at the front desk of the Wellness Centre. She's there Monday through Friday, 9 to 7. 9 to 7. Oh, good grief, 9 to 5. If you have to leave a message for her because she doesn't need to take lunch or she's on a call with someone else, she always will call you back before the end of the day. If there's a specific time that you need her to ring you back, feel free to leave that specific time, because I understand we're at work, we're not at work, you have other obligations. Our goal is to provide you with the information that you need. So she is there. I'm happy to contact you. You can phone and ask very specific questions, because I do understand some of the questions that come through the Q&A tend to be general, and I do answer those generally. Otherwise, book an appointment with us. Come and see us. We'll do that differential diagnosis. We'll speak about physical, mental, emotional, how the treatment plan works for you. And we'll get you started with us, because that's what we're here to do. So contact Robin if you have any further questions. Again, I'm Michelle Hay. Thank you so much for coming and listening to this webinar. I'll happily take feedback as well if there are specific things that I need to work on, and I hope to see you soon.